Good afternoon, everyone. This is our first time holding an event like this, and we already can't wait to do more. We think this is a unique opportunity for us to bring Haiti to you. Unfortunately, it's difficult to travel to Haiti at this time, but we're excited to be going live to Fondé Blanc soon, so you can hear more from our team. Before we get started, I just want to make sure you can see our agenda for today. I am incredibly proud of the work our team is doing to provide essential health care to as many people as possible under very difficult circumstances. As many of you know, those difficult circumstances include the August earthquake that really devastated the region near the hospital in the south of Haiti, and then the hundreds of aftershocks and additional earthquakes that our team has had to deal with, and the stress of having to constantly deal with all of those aftershocks. The tropical storm after the earthquake as well, the ongoing COVID pandemic, fuel shortages in the past months, and then finally, what's been very, very difficult has been the insecurity. Violence in Martissant, just outside of Port-au-Prince, has really cut off the South and all of the work that we do from the capital in Port-au-Prince. And none of what we've been able to accomplish would have been able to have been possible without the remarkably courageous and heroic work of our team members that you'll hear from in just a few moments, but also drivers, people in the warehouse, all the different folks who've made the work possible over the past months and made sure that we've been able to meet the needs of our patients despite tremendous challenges. And what we have seen over the past months is that in the last year, we have had over 150,000 patient visits at St. Boniface Hospital. And on top of that, over 100,000 patient visits in the areas most affected by the earthquake through mobile clinic visits that Dr. Saintilien will be talking about in just a few moments. We've seen increases in outpatient visits. Despite all the insecurity, we've seen a 20% increase in outpatient visits to the hospital, and ER visits are up almost 20% as well. Just remarkable work despite tremendous odds, and excited to have our team talk to you directly about it. None of this work would be possible without your generosity and partnership. There's so many great partners on the line today, and thank you for all that you do, and thank you for being part of our team. I'm excited to show you the story of one of our patients. Over those hundreds of thousands of patients, we like to share with you Alexa's story, who received care from us after the earthquake. So without further ado, I'd like to show you Alexa's story.
Les grands secousses la fin passé, la ge bébé à terre courir vini et puis nous retire en pile bloc. Moi pense il mourir, il me soukel, il dit ça sous, il dit la me gagne espoir. Len courir en la rue, len regarder, nous et puis à cassé.
Mais malheureusement, dans le moment, vu qu'avec moi économique, je ne peux pas arriver à temps dans l'hôpital. C'est ça qui fait, nous-mêmes, l'hôpital faudrait nous pour nous des soins dans la musique que nous sommes capables.
Nous-mêmes, nous arrivons à chercher mon côté.
Some actually need several interventions, to get back to normal life. And till today, we still need a lot of resources to address the needs related to the earthquake.
Marcher sur lui, mal l'école, moi sauter contre sur lui, mal dans l'eau, ma l'église.
Les mouillés fondés blancs, docteur fondé blanc était bien pour un cam. Il va quitter petite la souffre. Après c'est Boniface. Bon Dieu fait pied petit moi là. Va penser il tape marcher mais il marche.
It's now my great pleasure to introduce Dr. Inobert Pierre, who is our Director General in Fonds Blanc. Dr. Pierre has been with us for over 20 years in Fonds Blanc and really leads the heroic and courageous and remarkable work that you're going to hear about this afternoon and continue to hear about. Dr. Pierre?
Yes, thank you, Conor. And good afternoon, everyone. I am Inobert Pierre. I'm a pediatrician and Director General at HEI St. Boniface. I grew up in Cap-Haïtien in the north of Haiti and have seen a lot of disaster in Haiti. From an early age, I was exposed to the lack of access of especially the vulnerable people to health professionals. And that's what inspired me to become a doctor, to help those vulnerable people. When the earthquake happened, I knew our communities would need help from HEI St. Boniface Hospital. And I immediately received phone calls from elected officials and community leaders asking us to come and provide care. Mayors and community leaders and other elected officials from towns like Lekai, Jeremy, Miraguan called and asked us to provide care. They needed everything from IV catheters, IV fluids, wound dressings, and medicines like painkillers, antibiotics, and so forth. I am so proud of the team who came together to lead the disaster response. They worked really hard, collaborated with organizations across southern Haiti and around the world. They made sure that everyone in need got care. We treated hundreds of thousands of people. And today, I'm going to share with you a short story about one of them. Poor Axel, a 75-year-old man from an area called Lazille, south of Fonds Blanc, where our hospital is. He came to our hospital on August 17, 3 days after the earthquake happened. He had a broken hip and was taken to a hospital where he couldn't get the care that he needed. He was then brought to St. Boniface Hospital by helicopter. When he came, he needed more than surgery. He hasn't had a shower since his injury. He needed new clothes and he was dehydrated. The staff quickly attended to all of his needs. At St. Boniface, we believe in treating the whole person, providing all the help we can, even if it means going above and beyond simply providing care. Upon discharge a few days later, he said that he had always wanted to come to the hospital, but never imagined that he would come with a broken hip. He thanked the staff and said that he will be praying for them and all those who helped make such a great work possible. I knew he meant our generous donors. On the follow-up visits, he was doing great. This kind of care must continue. That's why we still have ongoing mobile clinics and have opened the new orthopedics program. Now, we will hear from some of our staff who are leading this great work. First, I will introduce you to Dr. Elie Saintilien. Dr. Saintilien has worked at St. Boniface for 6 years. He led our COVID response, then the mobile clinics, and now he has stepped into the role of medical director. He is such a great example of how our team is always ready to step up and do what needs to be done to help the people of Southern Haiti. Thank you. Dr. Saintilien.
Bonsoir tout le monde. Moi, c'est Elie Saintilien, docteur, coordonnateur clinique mobile, directeur médical de l'hôpital Saint-Boniface, Fond-des-Blancs.
Good afternoon, everyone. I'm Elie Saintilien. I'm a physician, the mobile clinic coordinator, and also the medical director at St. Boniface Hospital.
C'est un plaisir pour me présenter nous, travail qui fait dans l'activité clinique mobile.
It's a pleasure to be here and tell you about the mobile clinic activities I've been coordinating.
Après passage tremblement de terre 14 août qui a ravagé la région sud pays d'Haïti, projet OP dans tête collé avec HEI qui mobilisé équipe clinique mobile, agent santé pour être capable de mettre camper service santé de base.
Following the August 14, 2021 earthquake that devastated Haiti's southern region, HEI partnered with Project Hope to build teams of clinicians and community health agents to staff mobile clinics and health centers to help restore basic primary health services in the most affected areas.
Next. Pour ça, tu as fait, tu as un staff diversifié qui te là-dedans, agent de santé communautaire qui te joué un rôle potomitant dans l'activité là. C'est eux-mêmes qui te fait pont entre équipe qui t'a bail la SBH et monde qui te victime dans la communauté.
To that end, we mobilized various teams of clinicians, including community health agents, who played a key role as a link between the healthcare centers, the mobile clinics, and the most affected individuals in the communities.
Next. L'équipe a fait un pile gros sacrifice pour aller bailler soin à monde qui n'a besoin. J'en ai capable là, en pile dans zone que le tap travail accès était vraiment difficile. Pas de l'eau, pas de route, pas de courant. Parfois c'est sous bourrique, vous obligé de mettre des médicaments yo, marcher plusieurs dizaines de kilomètres pour arriver prendre soin de monde qui n'a besoin yo.
As you can see on this picture, our team sacrificed a lot in order to provide the necessary care to the people in need. Many of these sites were hard of access. There was no water, electricity, or even roads. At times, our teams had to use donkeys to carry meds and had to walk hours to reach those in need.
Next. Grâce à l'argent, nous te recevoir dans mes donateurs, nous te arrivé bail plus passer 100 000 moun soins. Parmi eux, te gen ti moun, grand moun, ak femme enceinte.
Thanks to the money we receive from donors like you, we've been able to provide care for over 100,000 people, including pregnant women, children, and elderly patients.
Next. Pendant nous avons parlé de femmes enceintes, bien ça à mon ville, c'était une femme enceinte 31 l'année. Il était sur une mois grossesse. Il pas senti bien. Il était profité d'aller dans l'activité clinique mobile là. Docteur a évalué, il était santé pas trop bon. Il devait casser les os. Docteur a transféré à l'hôpital Saint-Boniface.
One story that comes to mind is that of a 31-year-old pregnant woman called Samora Monville, who was 8 months pregnant and experiencing complications with her pregnancy. She decided to visit one of our mobile clinics where our doctors evaluated her. At that time, her water broke and the doctors had her transferred to St. Boniface Hospital.
Rive l'hôpital Saint-Boniface, il était joint bon gens accueil. Il était accouché un petit garçon. C'est comme ça, après exéa, il était continué à faire suivi avec petit garçon dans la clinique mobile.
Samora subsequently gave birth to a healthy baby boy at St. Boniface Hospital and continued to visit the mobile clinics for her son's follow-ups.
Jusqu'à présent, Samora a témoigné si ce n'est pas grâce à l'activité Silayo, ni lui-même, ni petit garçon, lui, pas bien la vie, je ne dis pas. Il toujours dit merci clinique mobile, merci Saint-Boniface.
Samora often says that she would have died along with her baby if it had not been for the mobile clinics and St. Boniface Hospital. She always says thank you to the Clinique Mobile and thank you, St. Boniface.
Next. Malgré tout, il y a un pile l'autre bagaille qui était pour faire. Tant que renforcer le système soin dans la région sud là, reconstruire donc cette santé maniche là, bail centre là bon gens support pour les cas bien autonomie, faire plaidoyer avec le ministère de santé publique pour capable bien bon gens soins qualité, bon de l'eau avec bon gens projet assainissement.
Although a lot has been accomplished, there is more to be done. We hope to continue our work in the southern region of Haiti by supporting other health facilities through system strengthening. This would include rebuilding the health center in Manish that was destroyed in the earthquake and continue advocating with the Ministry of Health and funders to provide quality care and access to clean water to all.
Dans vision nous, c'est à ouais activité ça a toujours continuer dans zone qui était frappée parce que besoin a toujours été en pile en pile.
We really hope to see these life-saving activities continue in the region that were most affected as the needs are still great.
Nous voulons un gros coup de chapeau pour toute barrière qui te mobilisé cœur, intelligence yo, ak poche yo, pour te aider moun dans 6 pays d'Haïti qui te frappé en pile par gros catastrophe si là. Merci.
I would like to thank all our donors who have poured their hearts, knowledge, and money into helping people that have been affected by this earthquake in southern Haiti. Once again, we would like to thank you very much for your support.
Thank you very much, Dr. Saintilien. And now I'm going to introduce you to Dr. Schiller Alexandre. Dr. Alexandre joined us in August of last year, just after the earthquake, as Chief Orthopedic Surgeon. He has helped us launch the new program. He's performing surgeries himself and leading the team. We could never do this work without him. Now, turning it to Dr. Alexandre.
Good afternoon, everyone. Thank you for being here with us. My name is Schiller Alexandre. I am an Haitian orthopedic surgeon. Shortly after the August 14 earthquake, I boarded on a UN humanitarian flight to Les Cayes, more specifically to Fond-des-Blancs. Here, under the leadership of Dr. Pierre, most of the relief effort for the victim have been provided at St. Boniface Hospital. As mentioned earlier, natural disasters such as earthquakes represent a great threat to Haiti because they cause a lot of material damage and human victims. 80% of earthquake injuries are orthopedics. Those injuries without proper care can lead to a life-threatening condition resulting to the death of the patient. Unfortunately, orthopedic care are extremely rare in Haiti. A permanent orthopedic program has then been launched at St. Boniface Hospital in November 2021. Our goal was to provide a continuum of care for patients. The orthopedic unit of St. Boniface is specialized in the management of all orthopedic and traumatic conditions involving the musculoskeletal system. Initially, we have been working as a small team of emergency response. Now, as you can see on this picture, we have grown up into a much larger group. Thanks to the contributions from our donors, we have been able to treat more than 1,000 patients. We provide emergency orthopedic surgeries 7 days a week. Scheduled surgeries are done on Tuesday and Friday. Outpatient clinics are available on Wednesday and Thursday. Two special stories come out of my mind. One is about Wilson Doval, a survivor from the August 14 earthquake. He is an 18-year-old boy living in Beaumont. He was outside his house when the earthquake happens. His left thigh got crushed by a huge rolling rock. He spent 3 days stuck on the huge boulder, praying God to save him. Where he lives, there are no health centers, no district hospitals able to provide him orthopedic care. He was miraculously rescued and brought up at St. Boniface Hospital by helicopter, where he had an emergency surgery to his left broken femur. Today, Wilson is walking again, and he's happy to return to a normal life. Another story I'm thinking of is that little girl from this video you've just seen. She was brought to the orthopedic department at St. Boniface with an external fixator to her right femur with infected wounds. She was very anxious. She got back to school again. Our team quickly managed to remove her external fixator. Wound care were provided, and after receiving antibiotics and pain medication, she has been discharged. Alexa has been able to walk again and return to school with her friends. Our goal eventually is to strengthen our orthopedic unit and also being able to provide better care for a greater number of patients. We are looking forward now to have a more dedicated space for orthopedic activities and increase imaging capacities. I want to address my special thanks to Dr. Inobert Pierre for his extraordinary commitment to St. Boniface Hospital. I also want to express on behalf of my staff our gratefulness to all our incredible donors who had made everything possible. Thank you everyone for your attention.
Thank you so much, Dr. Alexandre. Thank you, Dr. Saintilien. Thank you, Dr. Pierre. The three of you represent just incredible team that we have in Fondé-Blanc, over 500 staff members who make all of this work possible. And the reason we want to do this event live was really so that we could make sure to have a chance to let people ask questions to our team in Fondé-Blanc. So I'll try to do my best to pass around questions that you might ask. And if you can ask those questions in the chat function on Zoom, in the question and answer section on Zoom, or if you'd like to ask the question directly, you can just raise your hand on Zoom. We'll call on you, we'll unmute you and allow you to ask the question directly. But thank you everybody for the presentation. And now let's go to Q&A and we'll go through the chat and the Q&A section section of Zoom to see if there are any questions for our team. As a reminder, you can just raise your hand as well on Zoom, or press the raising hand emoji, and we'll unmute you so you can ask your question directly as well.
One question that's just coming in, Conor, is to ask the doctors, what is their biggest challenge right now?
Great. Well, Dr. Pierre, why don't we start with you? For you, what's the greatest challenge we're facing currently?
Yes, thank you for the question. It's I'm going to try to address it. Actually, we have many challenges, but one of the greatest challenge has to do with the fact that this hospital, because of its uniqueness in providing quality healthcare, has been growing steadily over the past years. And as it grows, the challenges grow as well. We are serving more people, saving more lives. So we need more and more resources to address the needs. We need funding, for example, to build a space for our orthopedic patients, to buy equipment, supplies, the medicines that we need, to hire more qualified staff to help out with the work, and so forth. And when we receive any financial support, if it is unrestricted, not limited to a specific need, this gives us the flexibility that we need to fill all the gaps whenever necessary. So we need more funding to make sure that we address the needs, not only of patients coming from the Southern Peninsula, but now that patients are coming also from even the north of the country. So that's our biggest challenge, to match the needs. Thank you.
Thank you, Dr. Pierre. Thank you. I know that as we talk about the biggest challenge, in addition to what you've mentioned as well, just the security challenge that you are continually up against now with all of our work being cut off from the Capitol, the resourcefulness and the courage and the heroic work of our team to make sure that supplies can get out to the hospital, that staff members can get to the hospital, whether that's by helicopter or by barge or going through the mountains around some of the violence in Port-au-Prince. It's just amazing how much the team has risen to the challenge and been very creative about making sure that everything runs normally despite all of that.
Another question that's, oh, sorry, go ahead.
No, please go ahead.
Another question that's just come in from John Leary. Does St. Boniface have a doctor and nursing training program for those who aspire to serve the people in the Fond Blanc area? If so, how long does it take to train new staff?
Why don't we give that question to Dr. Saintilien, our Chief Medical Officer. Dr. Saintilien, question c'est, est-ce que nous avons une formation pour docteur avec Miss dans l'hôpital Saint-Boniface là? Et si nous avons une formation dans l'hôpital là, combien de temps et formation ça a conduit?
Oui, oui, effectivement, nous avons des séances de formation, donc pour docteurs avec infirmiers dans l'hôpital là. Donc chaque mardi, chaque jeudi, nous avons des présentations académiques que nous faisons. Et on commence de 7h40 jusqu'à 8h, jusqu'à 8h30, et on finit. On finit le temps. Chaque mardi, chaque jeudi.
Okay, so Dr. Saintilien is talking about specific training that happens on a weekly basis for existing clinical staff, which is every Tuesday and Thursday, we have education sessions for the existing clinical staff. What I could also add to what Dr. Saintilien is saying from a training perspective, while we don't have certificate programs, we are a teaching hospital that receives residents that rotate through the hospital on a monthly basis throughout the different services. So whether that's pediatrics, OBGYN residents, whether that's surgical residents and now orthosurgical residents. We have trainees that come out on a monthly basis and then rotate through residency programs under our clinicians. Over time, our hope is to get up to certification programs, but we have some certification programs within community health and community health workers, and making sure that our community health programs have certification programs as well. And then nurse trainees come through as well. But we do have a significant amount of training that happens. Anything that I'm missing, Dr. Pierre, Dr. Saintilien?
No, I think the list is complete. We train both nurses, doctors, and all categories of healthcare practitioners. Thank you.
Another question that's come in from Rob Morrison. How are you trying to balance the disaster response with ongoing preventive care and general wellness of clients?
Dr. Pierre, do you want to take that one?
Yes, thank you. Thank you for the question. So one of the biggest assets of the hospital is the staff. The staff is very dedicated and always ready to go above and beyond what is needed to address the needs of patients. So what we do, we try to make sure that we keep providing care wherever it's needed in the communities that we serve in the aftermath of the earthquake. But at the same time, we need to keep providing care at the hospital and address the needs. So we've been splitting and making sure that we fill all those gaps wherever we see them. So we rotate the staff, and we also hired new staff because actually the needs were so great that we had to bring up new people. And I think at this point, all I can say is the staff has been doing great work, and we also have very positive feedback from the people that we serve everywhere that our teams have been serving them.
Thank you, Dr. Pierre. And the only thing I would add is we've really done, and you've really done, three things at once. You know, keeping the hospital going and making sure that those services are provided just like they were before the earthquake. Then with some restricted funding, really a massive scale up led by Dr. Saintilien, as you saw in the slides, over 100 new staff members that had to be hired immediately right after the earthquake in August, and then mobile units in those areas to make sure people got care. And that was over 100,000 patient visits that we would normally not do in a given year, but had restricted funding to do that after the earthquake. And then a continuity of all the really remarkable community health programs led by community health workers and our community health staff around vaccinations, malnutrition screening, increased COVID vaccination, and one of the most successful COVID vaccination programs in the country. So it was really a question of doing both and getting enough resources to be able to do all of those things at once. Great question, Rob. I think we also have a question from David Campbell. Lisa, we got one just now?
Yes. Would you like to read it?
I'm trying to pull it up, sorry.
Sorry, David Campbell says, thank you for arranging this session. What is your relationship with the Ministry of Health? Do they provide support in any way?
Dr. Pierre, should we shoot that one over to you again?
Yes, thank you for this great question. We have a very close relationship with the Ministry of Health. Actually, we've always had a very close relationship with them, and we collaborate in many areas. For example, they send us on an annual basis social service residents where they can give back to the community where we work, and also complete their training. They also help us with vaccines, for example, through their departmental office in Lekai on a monthly basis. And also
They support us in many ways. Anytime we need support for anything, any recommendation, for example, they would graciously come forward. At the same time, we also collaborate with them, and sometimes they would come to us to inspire, for example, during the COVID vaccination program. They sent teams to our hospital to learn from our community health department how actually we've been so successful in getting a high percentage of people vaccinated. And also we help them during the COVID vaccination program, actually it's still going on, with transportation of their vaccines to many sites. Actually, we arrange transport by air and sometimes by the road for them because they were limited in their ways to do it. So just to summarize, it's been a very tight relationship, and they see us as one of their main partners, and we really value that relationship. Thank you very much.
Thank you, Dr. Pierre. Lisa, any additional questions?
We had one more question from Lynn Black to talk about the training we're doing. So any additional thoughts on all the incredible trainings that are going on at the hospital?
Yes. This hospital, besides treating hundreds of thousands of people every year, has been more and more involved in trainings. And also hospitals and universities from all over the country want their young professionals to see our model and get inspired. And they want this model to be replicated throughout the country. So these days, we receive a lot of different categories of young professionals. We have rotating residents coming monthly to the hospital where they can see how the work can be better organized. And also they can see a very dedicated staff working day and night to provide care. And the rotating residents are the future health ministers of the country, and they want to see that such a great model where vulnerable people throughout the country can get access for free to quality healthcare. We also have social residents coming on an annual basis. We have interns from private and public universities. We have a ton of nurses also coming to the hospital regularly. So really, we are more and more involved in training, making sure that we can sustain what is being done and also replicate our model, because actually it's a model that even the Ministry of Health has taken as their main inspiration. So we think that training is part of the work that we're doing to make sure it's sustainable. Thank you.
Thank you, Dr. Pierre. And I guess the only other thing I would add that we've been working on recently as well is disaster response training and coordination. So given that we are in such a vulnerable place for hurricanes, and now a very active fault as well around earthquakes, the importance of disaster response training and coordination in the region, especially in terms of providing emergency health services, could not be more critical. I mean, Dr. Pierre and I have been together for a number of different emergency responses now, unfortunately, over the years. The earthquake in 2010, Hurricane Matthew in 2016, and Lynn Black was also involved in that as well. And then the earthquake this past August. And there's more and more of a push to ask HEI, St. Boniface Hospital, to really step up and lead coordination and training efforts. So we're really trying to get out ahead of that and do more training for other facilities in the region, and also to use that as a way to do coordination among all the different facilities as well. So it's another area that we're now doing training on as well.
One additional question from Rob Morrison. Besides ongoing financial support, is there anything we supporters can do to help?
Great question. Thank you, Rob. Dr. Pierre, I'd love for you to add to this. I think one thing that we've talked about a lot is we can always use more partners. So if there are groups that you think would be interesting for us to get to know, to set up new partnerships, other foundations, other organizations doing training, other individuals who are interested in this work, really introductions to others and people you think would be interested in being part of our team, I think would be a great way to help. I think that we've only built this organization through relationships like those and introductions. So if people have any, we're always open to them and happy to talk about anyone you think we should know. Dr. Pierre, anything you would add to that?
Yes, I think, as you said, Conor, sharing the news, the good news with other partners is critical. And those partners can bring in, yes, financial support, but also equipment that we need, supplies can really help us with many needs that we have. Even, sometimes we need hospital beds and all kinds of resources that make the care that we provide to our patients easier to do. So thank you for this great question.
Lisa, any additional questions?
No additional questions at the moment.
So we want to thank everyone to be with us today. We were honored to bring you virtually to Fondé-Blanc and have you meet with our team. Your support was so instrumental to our success over the past year. We could never do this great work without you. But still, there's a lot of work ahead. And we hope you will continue to stand with the people of Haiti and help us save more lives. If you have any follow-up questions, please do not hesitate to reach out to us by emailing president@haitihealth.org. Thank you, and we hope to see you again soon.
Thank you, everyone. Thanks for joining. Thank you, Dr. Saintilien. Thank you, Dr. Alexandre. Thank you, Dr. Pierre. Thanks all for joining us, and we look forward to doing this again soon and continuing to do these kinds of updates going forward. So thank you all.
Thank you. Thank you all.